most famous physical therapist on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
Together
therapist.
We are the most famous physical therapists on the internet.
In our opinion, of course,
All
Bob.
that matters, our opinion. Today we're going to talk about 3 things people with back pain should definitely try. This is for my nephew Alex, by the way. He's been having some back pain. I did not see him. I haven't assessed him at all, so I had to give him some kind of general advice that'd be good for anybody who has back pain.
So it'll be good for all of our viewers.
That's what we're hoping. So, by the way, if you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also, go to bobandbrad.com. Go to the giveaway section. We're always giving something away. What are we giving away this week, Brad?
Bob, we're giving a whole set of Bob and Brad banding with the handles. It's a whole kit.
Yeah, and we're also giving you some wall anchors to hook up to your wall.
It's a bonus, Bob.
Yeah, you can go to Facebook. The contest will be pinned to the top of the page. Go to Twitter, Instagram, or TikTok if you want a 60-second version of our program. I also just want to do a little shout out here, Brad.
Whoa.
We've got a blog section to our website, so when you go there, Deborah Rickzo, she's a PT with a doctorate of PT, by the way. She has written an article on back and pelvic pain in pregnancy and postpartum.
Oh, good,
So,
good.
You know, she's an expert on this area, so if you're having trouble with that, this is the article you want to read.
Good. It's nice that we can get some experts in that field because
we're not experts in that field.
We're guys.
We're guys.
Yeah.
Number one, Alex, the first thing I'm going to have you try is what we call direction-specific exercise. So for most people, and I'm guessing in your case this is going to be the case, when you bend forward or you lean forward or sit
with
bent,
poor posture
for a long time, it hurts. Generally what we do then, because this hurts this way, we actually have you extend the opposite direction to treat it. So I'm going to go ahead and what you're going to do is you're going to start off by lying.
There you go, Bob.
On the bed or the floor, probably the best on the floor.
Yep.
And you're going to lie here, and after a while, you might even get up on your elbows a little bit.
So he's going the opposite direction of that flexed poor posture, and we're going to, and there's some other benefits to this besides, but one way or another, you should, if it doesn't give you relief, either going too fast or it may not be the right direction.
Right. So then you're going to put your hands underneath your shoulders, and you're going to start doing what we call micro or mini press-ups.
Press-up, yeah, little baby ones. Bob's getting up pretty tall. You may not be able to go that high initially.
Yeah, what you don't want to do, Alex, is have your pelvis come off the bed like this. If it's coming off the bed, your back is really tight, and it needs to even work probably in a smaller range to start off with.
Yep, to the baby press-ups.
Yeah, and then eventually you want to get all the way up to, and again, keeping the pelvis down the entire time. You might have to have your wife, Deanna, actually hold it down. You know, I mean,
she could maybe sit on his belt line.
She could sit on it. He's a big boy. I mean, he is. He's a hard. Yeah. He played football and in college and again fractured. He thought it was T9. I thought he said.
So, but the middle of the back.
Middle of the back, but that should be better by now. That's
right.
Not.
Sometimes those old injuries come back to haunt you.
They do. Now, if you're over 55, this is possibly that might be the problem with you. You might have what we call spinal stenosis.
Right.
If it hurts when you extend the back, so like when you sometimes just standing up straight can hurt with spinal stenosis. Especially if you like lean back like this with your arms up, or even lean back just like this, and it hurts.
Yeah.
Then you might try flexion. Do you want to show that?
Sure.
Like a
chest. I personally have that component of spinal stenosis with my spondy. So if I do activities like even if I were to wash windows for a few minutes, my back becomes uncomfortable.
Because you're extending back.
Because I'm reaching up and back, and naturally my wife has to finish the job.
Sure.
Yeah, that's not a bad deal actually. So there are benefits to it. So what you can do, and what feels really good for me as well, as double knees, 2 knees, and bring them up to your chest like this. You may hold it for a few seconds, or if you can hold it for up to 30 seconds if you really like to. That's kind of up to you. I usually go pressure on or stretch on gently and really relax. You can do this one actually in bed. It doesn't make a big difference, or on a carpeted floor, whatever you're more comfortable with.
Again, Alex, I wouldn't think this one is for you. I don't think that's the one you're going to need. You might also try this one. This is a good one for almost anybody, and we're just going to have you do some rotation of the lumbar spine.
Sure.
So you lie down. I'm getting that lying lay down.
Yes, Bob. We're keeping our English majors happy.
All right. So you're just going to rotate back and forth. It looks like you're just moving the hips, but you're actually moving the spine too.
Yeah.
I'm keeping the shoulders down. And if it hurts one direction, just work the other direction.
The pain-free range.
The pain-free range. And then eventually try it again on that painful side and see if that hurts. Now, eventually, especially a younger person, they can actually start crossing over like this and stretch a little bit.
Right. So that tilts the pelvis more, which stretches and rotates that lumbar spine a little bit more, even up into the thoracic spine.
Again, keeping the shoulders down. And you can vary how high you bring the knee up.
Yep.
Because by bringing the knee up higher, I'm going higher up in the back.
Exactly.
So,
yeah, up by his T9 area, actually, so that, he may be able to work into that.
Maybe that's what he's going to want to do. All right, the last one. So, Alex, I'm going to have you do extensions, the first one I showed.
On your stomach.
And you can also do cat camels.
Oh.
Or whatever people have.
The dog, the
cows,
horse.
moose. I don't know what they all are. So, basically, I'm going head down, arching up. Head up, arching down.
This really does a nice job of giving complete range of motion to the lumbar and the thoracic spine. Notice how Bob brings his head up. Again, if it really hurts to go in one extreme, don't go there. Just go into pain-free range.
So Alex can start his day by doing some of these.
Sure.
And then go right up to these.
The cat and the camel.
Yeah.
Yep.
During the day, I think he does some sitting, Brad. He couldn't use a ball like this.
Should we talk about what kind of work he does or no?
I don't know what he actually does.
Oh, really?
I don't.
How old is this young man?
He's
roughly over 30s.
Yeah.
Okay,
yeah.
So he's pretty young yet.
Yeah. Do you want to show the ball?
Oh, yeah, absolutely. So yeah, in the chair, you've got a firm chair like this, and we want to get some nice range of motion to promote good posture and a stretch to the back. A soft ball, not a basketball wouldn't work at all, but a kickball, softball like this, and you're going to put it wherever it feels good. So you may start up a little higher, and then we're going to extend back over, and this would really work well. If there is some scar tissue from that T9 old fractured area, this might be. Get right to it.
That just might be the ticket. And like Brad said, you can put it right in the right spot.
This is, it's just nice to do this one. You can feel it stretch. It opens up your chest. You could just feel your lungs are able to breathe. So you're doing a lot more than just posture. You're getting some
I would definitely throw this one into your repertoire, Alex.
Well, yeah, there aren't many people I would, not recommend this to.
All right, Brad, let's keep moving on here. So do you want to grab the spine down there? The next thing that we want you to do is throughout the day, really avoid that rounded out position, that slumped position. You want to keep the back as straight as possible throughout the day. Slight curve in, slight curve out, slight curve in, which means keeping your back straight, basically.
Yeah.
So
technically it's not straight, but that's good neutral spine position.
Visually, what you might do is, this seemed to help my wife. She said, picture this. If you had a stick that
rotate this way a little bit.
Was running up and down your spine. It's got to hit 3 spots: the sacrum, the mid back, and the head. If it's hitting one spot only, that means you got a rounded out posture. So you're going to keep them all straight. So while you're sitting, you want to sit with good position like this, standing, lifting, all that. You're always trying to keep that back straight.
Yeah. We don't expect you to hold the Booyah stick to your back all the time, but it's a good visual. So maybe you can imagine that. And you said your wife, that helped her.
Yeah, it did. She was able to picture it then. If you're sitting a lot in a car or at the job, you might get a back support that just helps fill in that arch in the low back. And so we have a whole plethora of them.
Plethora, yes, Bob. Right. And it does depend. You can start out with just a towel roll and roll it up put rubber bands to hold it. So you get an idea if you need a thick roll or a thin roll, because you don't want to purchase one and find out, oh, this one's too thick. This one's a thinner one.
Right.
It's air filled. It's adjustable, and you're going to put it, typically right about belt line, maybe a little higher, a little lower. You'll know it'll feel good. For this one's not quite thick enough for me. Now this one is going to be too thick for me, but if he's a bigger guy,
he's a big guy. I think Alex might need a bigger one like that. So start with a roll towel and roll a towel up bigger and see how it feels.
Right.
And put it in a spot where it feels comfortable. So you should be, when you're sitting on the couch, by the way, you probably want to take a throw pillow and throw it behind your back.
Exactly.
You got to have something in there. There's one right up there, Brad. But
we have one here?
The throw pillow right there.
Oh, my goodness, yeah.
So, but if you're in a car, you should have something there on a regular basis so you're never sitting without anything. You had mentioned, Alex, too, that you have trouble when you sit sometimes on hard surfaces. I'd just go ahead and bring one of those bleacher pads along. I don't know what they call them, but
you mean for sitting on the bleachers watching your kids for hours on end?
Yeah.
Over the years.
I would just go ahead and bring it along, even if you're going to a restaurant. I got a hard bench.
Yeah.
Just go ahead and maybe he's getting a little sciatica. I don't know what
right. I do want to mention, Bob, because I know for people, if you find a throw pillow works really well, that pressure across the whole back. This is mine, and it's memory foam. And it has nice lumbar support, and it's really, for me, I've got spinal stenosis, and if you're over 55 or 60, that
might be more better for you.
Yeah, and that memory foam, it really, you can sink into it.
These really are personal. I don't like that one.
Bob doesn't like this one at all, but for me, it's just changed my seated comfort for sure.
The third thing you can do is core strengthening. Alex, I know you don't even have to focus on this one. I don't want you to start with this one. I just want you to start with those other exercises. But the other people out there, you might want to do, I'm just going to give you two quick ones. This one works the back itself.
Yep.
And so what you're doing is the pointer dog. We can start off with just your legs coming out like this. And then eventually you can go like this. And it's the pointer dog. You can hold for 5 or 10 seconds, and then you switch sides.
And a key component of this is also to tighten your stomach muscles up to get the whole core engaged, which sometimes is forgotten.
Difficult, yeah. So then that works the back and a little bit the core. We're gonna do a little bit of also side planks.
Yep.
So you can start with your knees bent and just get up like this.
There you go, yep.
And this is working the core. Eventually you can go to the legs if you put one foot in front of the other, and you can do it like this.
A little more difficult.
Yeah, you can do, actually with all these, you can do with these two.
Sure.
You can do sets of 20 to 30. Eventually.
Yeah, it might be difficult at first, but take your time.
It's not like where you're strengthening bulky muscle. You're trying to tone muscle so you can actually go at higher reps.
Right. Postural muscles that have long endurance.
All right. The other thing, Alex, lots of walking is good. Walking is always good for the back. Believe it or not, you get a lot of, a good 20 to 30 minute walk every day helps get more blood flow to there, and the back is moving while you're doing it. So
nice flat surface is best.
Well, good luck to you, Alex. And we did get him. I got him a massage gun too.
Oh, you did?
Yep.
Oh, good luck with that. When's he getting it?
He should have gotten it.
Oh, really?
So,
good.
All right. Peace.